Welcome back to Medicare 360 radio show, where we turn confusion into confidence for your healthcare and retirement decisions. I'm your host, Jennifer Alfonso Lee, certified long-term care specialist, investment advisor representative, and founder of Premier 360 Insurance and Financial Solutions. Today's shows cover some of the most important updates shaping 2026 and how they affect just about every senior in America. We'll be diving into the 2100 annual cap on prescription drug costs, the insulin savings program that limits insulin to just $35 a month, and how to file a Medicare appeal if you ever were denied coverage. These aren't just headlines, they are life-changing updates that can protect your health, your wallet, and your peace of mind. So definitely 2026 marks a milestone year for Medicare. For decades, many seniors struggled with high drug costs and unpredictable out-of-pocket bills. The donut hole phase confused everyone. So in 2025, first time ever, Medicare is setting a hard ceiling. You'll never pay more than that $2,000 per year out of pocket for any covered prescription drugs under Part D. And in 2026, that will increase to 2,100, but that's okay. But the key thing is that it has to be covered. So please make sure to review your drug plan to just make sure all your drugs are covered. But that is a huge relief for anyone who takes expensive medications for diabetes, heart disease, cancer, or autoimmune conditions. So let's just put this in perspective. If you were paying $500 a month for meds, that's $6,000 a year. Under like the cap for this year, next year, it would be $2,100 for 2026. And your plan will cover the rest. So that's really great. That just means more predictability, fewer tough choices, and more room in your budget. Also, there is a kind of a program where the insurance company could help you allocate that into monthly installment payments as well, if that's going to help. So keep that in mind. So how it works is that the 2,100 limit applies to your total out-of-pocket costs to cover your Part D drugs, your deductible, your copays, and your coinsurance all count toward that number. Once you reach 2,000, you pay $0 for covered prescriptions the rest of the year. But if you qualifiers, it doesn't include your monthly plan premium. So that's one of the biggest things to look at when choosing a drug plan, because oftentimes there are plans with larger premium amounts compared to lower ones. Their drugs are covered or you're paying very minimal on the drugs, but keep in mind you are paying a larger premium. It also only applies to drugs on your plan's formulary. So checking your formulary every year is crucial. And that's the thing, right? There might be some prescription drugs that aren't covered for next year that were covered this year, or vice versa, right? Maybe it wasn't covered this year, so you had to pick a different drug plan, but for next year it's covered. So keep that in mind as well. It doesn't apply to medications given in a doctor's office or hospital. Those are billed under Part B. So, example, if you're getting an injection like Prolia at the doctor's office, they ordered it, they injecting it, that should be under Part B. So this is part of the Inflation Reduction Act rollout that was rolled out in 2025, and which also introduced like the big item that was the insulin savings program. So that helped others as well. So diabetes affects over 16 million Americans on Medicare, and insulin has been one of the most unaffordable drugs. Now, thanks to the Medicare Insulin Savings Program, insulin costs are capped at $35 per month prescription, for most beneficiaries. So this cap applies to both Part D standalone drug plans and Medicare Advantage plans that include the drug coverage. This means whether you get insulin pens, vials, or pumps, your maximum cost is $35 per month, even if you haven't met your deductible. But remember, keep in mind, you need to make sure that that insulin is covered in the plan, right? Because sometimes your insulin may be covered in one prescription drug plan and not the other. So that is very crucially important. So if you are unsure whether your insulin is included, check your plan's evidence of coverage document or call your plan directly. The savings is immediate, tangible, and could save many seniors hundreds, even thousands per year. So even with these improvements, plans still differ, and that's why annual reviews are non-negotiable. Ask yourself, are all my medications still covered and in the same tier? Because there are levels like tier 1, tier 2, 3, 4, 5, 6. And so depending on the tier on your drug, you could be paying very little or a lot. And some plans do have deductibles of $615 or lower, depending on the plan itself. So you got to also take that in consideration. Have my copays or deductibles changed? So that's what I'm mentioning. Some plans, they are going off a percentage of the cost of your drugs. Some plans are going off a copay. So that might be something that could be a very big cost depending on how the insurance company covers your drug. Did my plan raise my premium or shrink my network? So the biggest thing on that, there are plans that cost $100 or $200 premium versus plans that are at zero cost, right? So really understanding how your drug plan works, it makes all the difference. Does my Advantage plan still include dental, vision, or hearing? So definitely there are plans that have decreased. Really, most of them, I feel like they've either stayed the same or decreased. There are a few, I would say, that are trying to get their dental plan better. Even in some cases where implants may have been included, may now be excluded for next year. So make sure that you are reading your annual notice of change, your ANOC, and that will show you for 2025 what changes there are going to be in 2026. So it's very clear and outlined there, but of course your licensed independent agent should also do that as well. Okay, so does the annual enrollment time, October 15th to December 7th, it's your time to compare your plans, and this year changes to make it even more important because it's a lot of instability right now. So definitely insurance companies have to pivot and also change their plans, their drugs, their premiums, you name it. There's just a lot of changes. So if you've been putting it off because it feels complicated, my team at Premier 360 can simplify it for you in one personalized consultation. So let's shift gears because sometimes even with the best coverage, Medicare or your plan might deny a service or a drug you need. So maybe your doctor ordered a medication that wasn't on the formulary. Maybe your plan said something wasn't necessary, medically necessary. So the good news is you do have the right to appeal any denial, and there's a clear process for doing it. So let's walk through it step by step. First, request an explanation of benefits. Every month, your plan sends you an explanation of benefits listing what was covered and what wasn't. If you see something denied, don't ignore it, right? Step 2 is file an initial appeal within 60 days. You call your plan or submit a written appeal. State clearly why you disagree and include documentation from your doctor supporting medical necessity. So really, for the prescription drugs, what you could do is, if we know that it's not even covered, still have your doctor run it through, and then it goes to the pharmacy and then it's not approved. We could call in the insurance company to file that appeal. Then the insurance company will contact your doctor's office to see if what they say, basically, like, are they approving it? What's the justification of you taking that prescription drug? Are there other prescription drugs you could take, alternates, or like, are you allergic to the other ones, and so forth? So your doctor should send that back to the insurance company and hopefully get it approved. The biggest thing I would say is, like, sometimes a client gets a letter of denial. You think it's a denial, but really no, it's the drug is covered, but needs a pre-authorization from the doctor. So that's when the doctor's office really needs to complete the information, right? Some doctor's offices are really fast, some are very slow. So sometimes things fall the crack, and sometimes you need to advocate for your own health. Of course, here at Premier 360, we will advocate for you and we will help you, guide you through that process. I know your time is valuable. You don't do this for a living, and we do. So we know what to do to help you. So step 3, if it's denied again, escalate to an independent review entity. You can try another time to get it appealed. So this level is handled by a neutral third party, not your insurance company. So step 4, continue up with the chain if needed. You could go all the way to the Medicare Appeals Council or even federal court if that's serious, right? So many seniors do win their appeals, especially when they included detailed doctor letters or proof that the medication has worked. You can get help from your doctor or licensed Medicare independent financial agent like our team, who could guide you through the process. So remember, appealing isn't complaining, it's exercising your rights. So the biggest thing on this, I would say, is just know your rights, know your advocacy, have someone advocate for you like us, because that's what we do. Oftentimes, clients may complain about the insurance company, but sometimes it's insurance companies not getting that approval or that letter from the doctor. They have no clue what's going on, right? So sometimes things fall off the cracks. Your case manager, if you're like at the hospital or skilled nursing, they really either could help or break, your service at that point. But know that you do have rights, and you should make sure you're getting that right. So advocate for yourself. We definitely love to advocate for our clients too, especially if you do not know your rights or you don't know what's covered in your plan. We're able to help you on that. And sometimes it's just understanding what your plan covers to make sure that you're getting the level of the care you need. So while we are talking about finances, let's quickly touch on IRMA. That's the income related monthly adjustment amount. If your income is higher, you might pay more for parts B and D. But what most retirees don't know is, if your income recently dropped due to retirement, divorce, or the sale of your property, you could appeal IRMA too. That's right. You just file Form SSA-44 with Social Security and explain your life change. Many seniors do reduce that premium that way. So it's another example why staying proactive can save you real money. And sometimes also, right, that falls through the cracks. So you definitely have to follow up with Social Security. And sometimes it's a quick call. I had one where a client they said no, decline. We then said no. She did sell her home and she became a widow. And she's like, oh, okay. We didn't know about that part. So that's something definitely you could file that appeal. Need that form? Let us know. We could provide that for you. So, with all these changes, scammers are taking advantage. It is very concerning that with rules and regulations in place, we still have scammers, or just not even scammers, telemarketing. I know, I get it. They want your business, but there's a right way to do it. Clients are getting about 10, 15, 20 calls a day, even text messages. They are not supposed to do that. If you did not ask or request for information from a licensed agent, then you are not supposed to get calls. Clients are just now in the days where they're just muting their calls, not picking up the phone, which is very unfortunate and very frustrating. I get that. So these scammers or calls will call claiming to update your plan or confirm your Medicare number. Don't fall for it. Medicare never calls you out of the blue. I actually had one instance where a client, they had called her. They said, "Oh, you are on this plan." And she knew exactly what plan she was on. And it was not that plan. But she kind of went along with it. Then they wanted to ask her for her Medicare number. So that, right? Sometimes you may not know what your plan is on and you just believe and trust that individual. But yeah, do not give them your Medicare number. And if you get a suspicious call, hang up and contact 1-800-Medicare or your trusted advisor just to make sure, because there are some really savvy letters and telemarketers that do go out there and try to scam. Like hospice is a big scam right now, where they get your information, they bill up Medicare 5, 6,000, who knows, 8 to 10,000. And while you are not liable for that, I mean that's fraud, waste, and abuse. So definitely guard your Medicare number like it's your credit card, because once it's stolen, it's hard to undo the damage as well. Okay. So with all these reforms, the 2,000 cap this year for medication, 2,100 next year, insulin savings, drug negotiations. They're part of a larger movement to make Medicare simple, fair, and more affordable. But of course, sometimes because of these changes, these insurance companies are also saying that they are not making any money. They're not being profitable. Star ratings have definitely gone down for some insurance companies. And they're actually fighting that too with the government, because um, just a little tangent off star ratings is, the lower the star ratings, the less money these insurance companies get from Medicare and the government. The higher the star ratings, the more money they get from the government, which entails provides better service to their enrollees or the beneficiaries, right? So that's the thing. We are entering an era where preventive care, digital access, and medication affordability are front and center. But with these new programs come with new complexities, which is why education is your best defense. And at Premier 360, we do believe knowledge isn't just power, it is protection. Understanding your rights, understanding your plans, how they work, maximizing your benefits. Times are tough right now. Food costs, just everything with inflation has dramatically increased. And then some of our benefits are decreasing, which are unfortunate. But just knowing and planning ahead, especially if you are relying on the grocery cards, the utility cards, what can we do to help better assist you, help you better find better benefits for you, and just even free services in your area locally that may help your situation as well. So let's just recap. The 2,100 cap is a game changer for out-of-pocket prescription costs. You are able to make these payments. I just can't remember on top of my head what they're called, but you can divide your payments into 12 if it may be easier for you to pay for that. Then we have the insulin savings programs that have been actually been going on for quite a couple years now. It does make life more affordable for millions living with diabetes. And if you're ever denied coverage, you do have the right to appeal and fight your benefits. And the biggest thing I always advocate is just advocating for yourself because you may be the lucky ones that get the right service providers, great doctors, great hospitals, great case managers, but you also may be unlucky and get ones that truly don't care. It's just a job to them, and you gotta fight for those rights. And I've seen it. Recently, I had a client that was the hospital for very long. He didn't know how long he could stay for the hospital because typically, right, the hospital wants to kick you out right away because it definitely costs them a lot of money versus what the payout's going to be. And then, so they were scared that he would be kicked out. And then they wanted to put him in acute skilled nursing facility, and it was denied. And thought that was strange, right? Because this person was in dire need. And so we helped call three-way with insurance company. Come to find out, they never received a authorization or referral. So can you even deny a claim? I think they were just going off what the case manager was saying, which yes, you should trust, but I mean, it doesn't make sense. So we did our due diligence, and then they could go to that case manager and tell them, there was no authorization or approval even sent in. So unfortunately for my client, things took a turn for the worse, and he did pass. It's very unfortunate. He's been my client for quite a long time, and it's also just sad. My clients become part of my family as, reviewing their plans every single year or just any time of the year they have questions. So it is tough seeing that. That's why advocacy for health, making sure you are doing your preventive exams and just making sure you're taking the steps to be healthy. Because I know I do have clients that don't even go to the doctor. They don't care to go to the doctor. So that's tough too. And then sometimes it's just too late when you do. So establishing that care, I would say, is very important. Get to know your doctor. If you don't like your doctor, you could always find another doctor, right? You don't have to stay. So definitely, these changes prove one thing: Medicare is evolving. Staying informed is how you'll take full advantage of all your benefits and all the rules and laws coming into effect. So if you'd like a personalized Medicare 360 consultation or need help reviewing your plan or filing an appeal, my team and I would love to help. You could visit premier360solutions.com or call our office to schedule your free consultation today. And so I'm Jennifer Alfonso Lee. This has been Medicare 360 Radio Show, your trusted guide to navigating Medicare with clarity and confidence. Until next time, stay healthy, stay informed, and take care of each other.